Hello, welcome to Proven Cures. I'm your host, Sarah McLeod. Today is Monday, October 19th, 2020. Thank you for tuning in. If you're new, also thank you to my subscribers for your loyalty. If you're noticing that this video looks a bit grainier than my other videos, that is because for the first time I'm actually using my computer to shoot the video as opposed to my phone, my iPhone. And the reason why I'm doing this is because the computer screen offers a much wider view than my phone, was sort of like just gives you my head and cuts off my surrounding environment unless I'm sitting all the way back. So this is sort of just a trial and error thing. When I upload this to YouTube, I will try to get the graininess out. If not, I apologize. Hopefully the information that I'm going to provide today will override the fact the graininess, the look of the video. So the last video I did was on treating autism with the use of a common diuretic known as Bumex. And when I did that video, in the comment section, it may have actually been my first comment. Someone asked me if I had any information for them on treating or curing schizophrenia. And at the time, no, I did not, but I promised to do some research, and my research revealed some interesting information. I did not find a complete substitute for pharmacological drugs, but what I did find was a study that actually looked at the supplementation of Halperidol, which is, of course, a drug prescribed by psychiatrists, the supplementation of Halperidol with omega-3 fatty acids, which have been shown periodically in various studies to be of deficit in people who have been diagnosed with schizophrenia. So let's get into the study. I'm opening it up on my screen now, so bear with me. Here we go. The title of the study is The Impact of Omega-3 Fatty Acids, Vitamins E and C Supplementation on Treatment Outcome and Side Effects in Schizophrenia Patients Treated with Halperidol, an open-label pilot study. The study was published October 1st, 2007 in a journal called Progress in Neuropsychopharmacology and Biological Psychiatry. The publishers are Sivrioglu, Kirli, Sipahioglu, Gursoy, and Sarandal. These names look Eastern European. I could be wrong, but that's what I'm picking up from the spellings. And I'm going to just share with you verbatim what I see here in the abstract because it sort of covers everything in terms of if you want to follow the protocol, what you would need to purchase in terms of supplementation, and what the outcomes were on the rating scales for symptoms, for schizophrenia symptoms. So, what it says here is that classical antipsychotics like haloperidol are suggested to increase oxidative stress, and oxidative cell injury in the brain. Pro-oxidant effect of haloperidol may influence the course and treatment outcomes of schizophrenia. Dietary supplementation of either antioxidants or omega-3 fatty acids was found to improve symptoms of schizophrenia. Thus, researchers decided to assess the impact of combining omega-3 fatty acids, vitamins E and C supplementation on treatment outcome and side effects in schizophrenia patients treated with haloperidol. Ongoing haloperidol treatment of 17 schizophrenia patients was supplemented with 1,000. So, this is where you would get out your pen and paper and write down what the supplementations were. They were supplemented with 1,000 milligrams of omega-3 fatty acids. And and that was taken twice per day. But what is must be noted here is that these are just not any old omega-3 fatty acids. Of what was consumed daily, 180 milligrams came from EPA, that's E as in egg, P as in Paul, A as in apple, and 120 milligrams of DHA, D as in dog, H as in Harry, A as in apple, twice per day. In addition to that, vitamin E at 400 IUs twice per day, and vitamin C 1,000 milligrams per day. The following scales were used to assess patients' symptoms. Patients were assessed with the Brief Psychiatric Rating Scale, the Scale for the Assessment of Negative Symptoms, the Simpson-Angus Scale, and Barnes Akathisia Rating Scale. And this was done over a 4-month period. They were also tested for the following enzymes, which are attributed to oxidative stress in brain cells. These are glutathione peroxidase, superoxide dismutase, malondialdehyde. Vitamin E and C levels were also evaluated, both at baseline, which is the beginning of the study before study treatment is issued, and at the end of the study. On all of the scales that I mentioned, scores obtained at follow-up visits were significantly lowered compared to scores obtained at the beginning of the study at baseline. Superoxide dismutase levels were significantly lower at the end of the study. No significant differences were detected in other lab parameters, so therefore there were no negative side effects. Results support the beneficial effect of the supplementation on both positive and negative symptoms of schizophrenia, as well as the severity of side effects induced by haloperidol. The effect of supplementation on akathisia is especially noteworthy, as it has not been investigated in previous studies. And if you're wondering what akathisia is, it is a movement disorder um, that is characteristic of schizophrenia. It is characterized by a subjective feeling of inner restlessness, accompanied by mental distress and an inability to sit still. Usually, the legs are most prominently affected, and those affected may fidget, rock back and forth, or pace back and forth. And some just have an uneasy feeling in their bodies. And also, it's also combined with muscle quivering. The restlessness often comes with muscle quivering in addition to the inability to sit still. It is often caused as a side effect of antipsychotic medication. So it is quite possibly brought on by the haloperidol. So when the haloperidol or antipsychotic medication is indeed supplemented, and I will repeat this, with 1,000 milligrams of omega-3 fatty acids twice per day, with 180 milligrams coming from EPA and 120 milligrams coming from DHA, in addition to 400 IU twice per day of vitamin E and 1,000 milligrams per day of vitamin C. The symptoms associated with schizophrenia and associated with the side effects of haloperidol treatment all decreased significantly over a 4-month period. That is the best that I could find in terms of immediate treatment. My background in clinical research, I've collected and managed data from cancer trials, HIV trials, diabetes trials, and various medical device trials, but never have I worked in the field of mental health. So I really have no direct experience or information from my own education or time to offer, in addition to what I'm learning here. So if you're watching this and you're a medical health professional, or you're a clinical research professional like myself, and you have something productive to add, to supplement this video with, or to correct me on, your comments are most welcome. If you are watching this and you are a mental health sufferer and you would like to make a comment that's also helpful, or ask any questions, you are most welcome to do so as well. Um, I always tell everyone, like, share, subscribe, but most importantly on this video, leave comments because I myself am very curious to see and hear what other people have to say about this condition and how it has affected their lives or the lives of people they know. Um, Also, I also always say that if you arrived at my channel due to primary interest in one area of disability or one area or one condition that you may feel at loss for information on, and you feel like, oh, well, I got all that I can get from this one video, there's no point in subscribing. That is not true. I am always finding new information on various conditions that if you personally are not affected by, you're probably bound to know someone who can benefit from the information. And for that reason, please subscribe. Like, share, subscribe. And this was very short. Thank you for tuning in. Probably also, like I said, because I don't know very much, but hopefully what I shared is very accessible. It's very easy to get omega-3 supplements. It's very easy to get vitamin E and vitamin C supplements. So it's very easy to try this out without worrying about negative effects on your body or on your mind. And it's definitely worth it to try it and just see if it will be helpful for you. Also, in my research, in my path to actually finding the study that I shared just now, I found where several articles stating that people with schizophrenia are at higher risk for developing cardiac disease and suffering from sudden cardiac death and cardiac disorders. And supplementation with omega-3 fatty acids help to subvert cardiac disease. So, in addition to um, helping to negate the symptoms of schizophrenia, of mental decline, and increase cognitive function. It's also cardiac protective as well, cardioprotective. So it's the omega-3 is both neuroprotective and cardioprotective. So that it does double duty in that sense, and thereby that makes it even more worth giving this protocol a try. So please do so, and let me know how it's affected you. And of course, take this to your physician, take this to your psychiatrist, who is of course also a physician. And maybe they may have heard about this study or something similar to it, or maybe not, and they will be interested in it and will be willing to work with you to take lab tests and um, give you those study scale rating scales to see how you're doing, prior to taking the supplementation, during, and after. So you can have your own protocol going, your own clinical trial going. Okay, and of course, like I said, let me know how that works out for you. And thank you for your time. Have a good day. Bye bye.